With the closing of Wilshire Health and Community Services, I wanted to find out if people who relied on these services are now able to receive them somewhere else. I'm Dylan Foreman, your community reporter in San Luis Obispo, following up on the closure I told you about back in June and the rippling effects it's having in the community. At the end of June, the longtime medical service provider offering everything from hospice and home health to community services like counseling and transportation closed its doors, leaving clients looking for help elsewhere. One Wilshire service going away is the Good Neighbor program that serves 172 clients on average. Executive Director of the San Luis Obispo Council of Governments, Peter Rogers, explained it's a huge loss due to its cost-effective model of utilizing volunteers as drivers.
Yeah, we frankly anticipate a tsunami of calls.
Seniors use the service for things like the grocery store or getting to their medical appointments. According to SlowCog, the average user is 77 years old, 75% of them are female, and 64% live alone, while 40% are low income and 67% live with chronic medical conditions and or mobility barriers.
And it costs a lot of money to provide ride assistance when you're paying a driver. We don't know exactly how we're going to solve this gap.
However, other services like home health and hospice care are being transferred over to organizations like Dignity Health, Home Health, and Hospice Care, getting 50% of the patients from Wilshire and sending offers out to 30% of their staff.
So our staff had to stretch to pick them up, but as far as I know, we didn't see any gaps in care in the ones that we really take on.
Kathleen Sullivan is the Vice President of Post-Acute Care with Dignity Health Central Coast, explaining that while it's a loss to lose a community partner like Wilshire Health, both they and other service providers have been able to find care for home health and hospice patients.
For the home health and hospice components, we're there. We have their staff on board that joined, and will continue to take great care of their existing patients and be there for those physicians.
SlowCog is still navigating the full transportation impact and will look for a solution come October when they go in front of the Board of Supervisors, while other community service programs are either in danger of being lost or being picked up by another service provider like Transitions Mental Health Association. Dylan Foreman, KSBY News.